When you think about statistics, in 2016, over 63,000 Americans died of this disease. What do we need to do as a nation to respond to this? But if we take it that those 63,000 people, they were sons, daughters, husbands, wives, moms, dads, grandfathers, and grandmothers. They were someone's friend. We have to make this personal.
As that starts to go on, we become desensitized to the size and scope of the problem. So if everybody's talking about heroin and everybody's talking about people who are overdosing, then it becomes secondhand. Just like in Chicago, they don't show every murder that happens overnight on the news because it's so frequent that people don't show the interest or the care for those things that they probably should. It's going to be overlooked as well. That's just part of life. That's just something going on now. Just one more disease out there that the medical professionals can deal with.
How the hell am I going to fix this? You know, I barely know what I'm doing from day to day. How am I going to do this? That's difficult. Every time an overdose text comes up, oh man, what could I have done for that? What could I do better for that? That really weighs on you if you're the person that people are looking up to try and solve a problem. That's rough. If you don't have a way to manage that, you're not going to survive very long doing this. You're certainly not going to be effective doing it for very long.
There's not enough of us to go around. So we need more hope dealers. We need more caregivers. We need the caregivers that are here in this community, know that each other are here, and be able to build those relationships and foster those connections so that we know we're not alone. And we need to focus on spreading the positive results that are happening and reducing the stigma by sharing the stories of recovery. That's a huge part of reducing compassion fatigue.
Compassion fatigue is exactly what it sounds like. Overwhelming feeling of being tired of caring. Just don't have the strength or reserves anymore to care because this just keeps happening over and over and over.
Compassion fatigue is giving more than what you have inside. The demands today of our jobs, our life, the struggles that people are having is more than what they have inside to give.
Compassion fatigue for me is when you have so many things requiring you to have empathy for somebody else or to put the needs of somebody else before you, and you forget that you also need to take care of yourself. Or there's just so much that you have to give that you're depleted.
I describe it as like showing up with your whole heart, putting it out there, and then forgetting to put your own oxygen mask on. We kind of bring ourselves and we remain open to sit with people in their darkest moments. You have to allow yourself to be open. You have to come there with an open heart of empathy. And sometimes when you sit with someone in that pain over and over and over again, you get a little tired and you need to recharge.
For compassion fatigue, those normal reactions to seeing crisis after crisis after crisis after crisis can come about in a disconnect and numbing, feeling disengaged, increased depression, increased isolation, increased sarcasm or negativity. All of those things that are our body's natural way of saying, hey, warning, something's wrong when you're doing so much caring for others that your investment in caring for yourself and refueling yourself gets neglected.
Compassion fatigue basically is as someone is in that situation, whatever that situation is, where they're a caregiver for someone, what winds up happening is that basically their internal resources get drawn down. I like to think of everyone sort of having a picture of human kindness that they kind of carry around with them. And our first responders, nurses, ER doctors, folks at home that are caring for their loved ones who are ill, they're constantly pouring out of that pitcher. Well, compassion fatigue is what happens when that pitcher gets empty.
Compassion fatigue happens in all of healthcare, not just addiction, and I'm sure for other professions as well. It happens across the board, but I do think it happens much more frequently with addiction in particular. It's a very tiring population because we're dealing with very tiring behaviors.
Near the end of my career as an EMT, I recognized that I had lost the compassion that brought me in to be an EMT, and I had to leave the field.
When you care deeply about a situation or a problem or a person routinely, and then you just don't have any emotional capacity to care anymore, because you don't have any empathy for anybody else or sympathy for anybody else, it affects your relationships with people that you love at home. You know, if you spend all day really caring about whether somebody kills themselves or not, whether somebody gets a home, and trying to affect some big life-changing problems in somebody's life, and then you go home and somebody hasn't unloaded the dishwasher, you've spent all of your empathy and compassion on somebody at work, but you don't have the patience to deal with a child who hasn't loaded the dishwasher. That affects your personal relationship. And if that affects your personal relationship and you're not managing your stress, then that affects your physical well-being.
When people get depleted and you feel that compassion fatigue, not only do you feel it emotionally, but you really feel it physically. It really can cause problems, not only for how you're responding professionally to other people, but in your personal life as well.
Primarily, the first part is lack of compassion, lack of tolerance, lack of support to the people that we love the most and that need it the most. And then from there, we begin to stereotype. We can move into our own denial systems.
Compassion fatigue. If we look at just saying that, that indicates that we need something. That if we are having compassion fatigue, that usually means we need some compassion ourselves, and to get that from other sources and other places.
I didn't know how to take care of myself. I didn't understand that I should be sharing how I was feeling with professionals, even with people that I worked with.
When things get scary, to look to the healers, look to the helpers. And I think that that's challenging when you are a helper and you're looking to your colleagues and your friends and your fellow caregivers, and you're seeing reaction of fatigue and drained and emotionally disconnected. And for the community, it is good to look to the helpers, and we're there. We're doing the help. We're doing the work. We have excellent first responders and people who are out there saving lives every day. But when, as helpers, we turn and look to each other and you see that loss, that becomes tragic, because then stigma spreads further. And also the disease of addiction and so many other diseases begin to kind of filter into our lives as helpers. That has impacted the widespread compassion fatigue.
I think stigma number one is just a deep misunderstanding. And it usually arises when we don't understand something, when we don't have the knowledge to be able to make sense of it. In order to combat it, number one, we would need to begin to educate not just, the masses per se, but in particular healthcare professionals, clinicians that even work in mental health versus the substance use disorder treatments. There's been a divide there. We need to have a clearer sense and understanding of that, sharing with them the scientific information and knowledge that we have, preaching about it being a disease, but we need to really take the time to help people understand the brain and some of the components related to that.
When we talk about compassion fatigue, first of all, for our first responders, they are having ordinary reactions to extraordinary circumstances that they are working in. They get to see some of the most difficult things that human beings witness. And so when we talk about that, there's also a piece to that where oftentimes we experience those things. And then because of also having that caregiver's heart, we typically are great at giving care to other folks over and over again, but then don't look at how do we take care of ourselves.
I know that this is a really frustrating disease for everyone, but it is particularly frustrating for first responders who get the most acute part of it and then get them somewhere where they can get help and then wind up having to deal with that same person again and again and again. They get compassion fatigue, they get overwhelmed.
That leads to divorces, poor child raising outcomes. If you don't have the compassion to raise your own children, you can end up with your own children being in crisis. That leads to provider suicides. That leads to provider burnout and good, solid people leaving the profession.
When we talk about the resources that are available, we know that we have a broad continuum of care in our community, but we also have to talk about capacity. And at this point, I think that we see a lot of resources getting overwhelmed, and dealing with compassion fatigue and dealing with empathy cup is a little less full than they'd like to see it.
Systems are not set up to help them not deplete themselves of everything that they have. So when they go home at the end of the day, instead of feeling I've done a great job, it's I'm completely exhausted. It's every service industry that exists today.
Our role here when we talk about compassion fatigue is identifying how these losses are impacting us and then taking some steps to take care of ourselves.
That is tied into this idea that the stigma of addiction, because I know that there are certainly diabetics out there who are not taking their insulin, who are not counting their carbohydrates, who are not following directions, and they're winding up in the ER over and over and over with high blood sugar, and they're winding up in the ICU with diabetic ketoacidosis, and their EMS is going out to their house frequently because they've had seizures or passed out because of their non-compliance. I don't see the same level of fatigue from first responders for those people. They are frustrated, they're annoyed. Anybody that is non-compliant with taking care of themselves can be frustrating for everybody. But I do think that there is a higher level of compassion for that, and there's never a discussion about, well, how many times should we give a diabetic a ride to the hospital when they've not taken their insulin? But certainly the how many times should we give Narcan to an addict who's overdosed discussion has come up over and over. How many times do we take them to the ER?
The first important thing that we need to do is remember that that comes from a place of fear and misunderstanding. So even though sometimes when I hear those things, I want to like reach over and choke them, I have to remember that that person sits there and they're coming from a place of fear. So I need to approach them just like I would anybody else in a kind way.
So when we talk about compassion fatigue, that's real. If you're anybody who's any good in this profession, you've experienced it, myself included.
We all have to recognize and support each other, or that compassion is not going to be there. We have to reach out and let people know exactly how we're feeling.
There's a difference between empathy and compassion. Having compassion on someone is respectful and kind and professional. Having empathy on patients, if you did that day after day after day for patient after patient after patient, you're going to have vicarious trauma.
Vicarious trauma is being traumatized by sitting, witnessing, being with, listening to somebody else's experiences of trauma.
Vicarious trauma is what happens when basically because of witnessing folks going through or being a part of a traumatic situation, that trauma gets induced on us, where basically we cannot unsee that which we have seen. Someone who is in a significant car wreck, that's direct trauma there for the folks that are involved in that accident. But for the first responder who may be seeing those things and seeing things that most human beings don't get exposed to, they wind up having that trauma happen vicariously. It's sort of like one step removed from being directly in the scene.
But with secondary or vicarious trauma, what that is being exposed to so many traumatic events, hearing so many traumatic stories day after day after day after day. For first responders actively witnessing or seeing those events take place, it impacts our brain functioning. It impacts our compassion. It impacts our ability to focus. It impacts our ability to breathe.
When you have compassion fatigue or vicarious trauma or secondary trauma, it is very easy to lose hope. When you are daily giving to other people and trying to help other people and maybe not thinking of yourself first, it is easy to lose hope that there are good things out there in the world, and good things can happen, and good things will happen.
For first responders, the idea is they more than anybody need to get this sort of objective education about the disease. The frequency with which they're going to see the same people over and over is a direct symptom as to the severity of their disease process, not how bad of a person they are.
You don't solve a tough problem by getting a smart person in the room and figuring it out. You solve it by getting 12 smart people in the room and talking about it. And if you start making a little bit of progress, that shows people that, well, hey, this was a huge problem, but we are fixing it a little bit.
There is a shift in thinking to say that trauma is trauma, and has been created to recognize that a person who's been involved in a secondary or vicarious trauma, to differentiate that even though that's been secondary, it still impacts them the same as in functioning as it would if you suffered significant trauma yourself.
But when we hear things like, oh, they're just an addict, my first reaction is, how are you doing? I've got 10 minutes. What's happening? And that literally changed their day.
We're not capable as humans to just feel okay all the time.
Taking care of yourself is so important, even if it just means taking a moment to breathe. I think people get in a moment where they feel they need to respond, they need to act to help somebody else, and really what would be best for themselves emotionally and maybe for the situation is to take a breath, be able to focus, and do your job.
Exercising and meditation, just giving yourself some time.
Step back. and step away. Do something else. Reduce your patient load and start doing hobbies that take you out of what you were doing and put you back into your own life.
Just recognizing A, that it exists, and B, if we're there to do that, let's avail ourselves for a few minutes, because sometimes that's all that it takes.